This video is about a horrible yet quite common skin disease of the penis named Lichen sclerosus or BXO, which stands for Balanitis, xerotica, obliterans. BXO is not exclusive to men, but also affects women. But since over 90% of my audience is male, I will only talk about the penis. Lichen sclerosus affects all age groups from infants to the elderly, but it is mostly found in middle-aged, uncircumcised men. It is a chronic inflammation of the foreskin of more or less unknown origin. It is not contagious, so don't worry about that. There is an association with diabetes, however, and there is some data which links BXO to post-micturition dribble because the urine gets in between the foreskin and the glans and causes an inflammatory response. Under the microscope, a loss of elastic fibers can be seen and the structure of the skin becomes thinner. The typical symptoms include burning and itching, and when the disease progresses and the elasticity of the skin decreases, the skin will slightly crack when the foreskin is retracted. These cracks are quite painful, and when they heal, scar tissue will appear. But scar tissue is even less elastic, so with time, it will be increasingly difficult to retract the foreskin until a point where it is no longer possible. In the comments I got from previous videos, this was a frequently asked question. How can adults develop a phimosis? Now you know how this can happen. In these late stages, the foreskin appears whitish with a typical white ring on top. Unfortunately, BXO is a progressive disease. So if you are unlucky, it will not stop there, but can also affect the glans of the penis and lead to subsequent scarring of the urethral meatus. This is indeed a serious complication because it massively affects urinary flow, and surgery in this area goes along with a high recurrence rate, leading to even more misery. So what can be done about it? I think prevention and early detection are very important. Lichen sclerosus is often not recognized until very late, and its prevalence is likely to be much higher than reported in the literature. It is paramount to reduce the likelihood for chronic inflammation, so uncircumcised men should gently retract the foreskin before urinating and make sure there is no urine left afterwards. Any urine dribbling from the meatus after you are finished should be eliminated with a soft paper. Then the foreskin is put back into place. In chronic inflammation, steroid ointments are the cornerstone of treatment. However, this should be done under medical supervision as the skin doesn't like steroids over prolonged periods of time. If the disease has progressed to phimosis or close to that, there is really no other treatment option than circumcision. Many patients want to try steroids at this stage, but according to my experience, it is too late, and steroids have proven to be ineffective patient after patient. Surgery will make the disease stop in many cases, but a regular follow-up makes sense, especially with spreading to the meatus in mind. One must not forget that BXO is associated with squamous cell cancer of the skin. So if left uncircumcised, there is an increased risk of failure to diagnose a cancer that may develop underneath. My advice is inspect yourselves regularly and apply proper hygiene. In case of inflammatory signs, talk to a urologist or a dermatologist. Thanks for watching. Bye-bye.